Hello, everyone. Welcome to a brand new episode of Tech of Fame podcast. And today I'm very excited to introduce today's guest, which is Joshua Bell. Joshua is a community leader and mental health advocate from Hamilton, Ontario, Canada, currently attending McMaster University for Political Science with a specialization in judicial studies and public law. Always being an active member within his community, Joshua is passionate about mental health and the well-being of others in his work to help not only raise awareness, but also push for changes to improve the mental health of everyone, including with the main focus of suicide prevention. Joshua currently sits on the National Youth Advisory Council of the Mood Disorder Society of Canada, the National Initiative for Eating Disorders, as well as a member of Frayme as a groundbreaker for mental health, in addition to much more. Mental health is such a big topic in today's society since the pandemic. I know it affected so many people since 2020, including me, and in so many ways it hits everyone differently. And I'm very thankful to Joshua for all the work he's doing to support people with mental health. But thank you so much, Joshua, for taking the time with us today to chat about your work with mental health. I really appreciate it.
Yeah, and I'm happy to sit down and chat a little bit over the next little bit about this, Kylie, and I'll pass it back to you to kind of start us off.
Thank you so much. So, of course, you are very passionate about mental health. You've been doing so many work in your community and around the world online on social media. But, like, did you kind of have a mental health journey or anything growing up?
Yeah, and guess I can kind of give you a little bit of the backstory as to how I kind of started doing some of the advocacy work that I'm doing now and that around mental health and that. And a lot of it came down to that personal experiences around mental health and suicide and poor mental health and stuff like that. So going all the way back to 2019, actually, a suicide attempt and that was kind of what kickstarted this and realizing, okay, well, having those feelings and everything like that, but also realizing, hey, there's a lot of resources out there, but people aren't really aware about them or how to access them or go about accessing them and things like that. And some of the resources that are out there, people can't access due to financial barriers or other stuff like that. So that's really where it really all started and everything.
Ooh, like guys, I know with a lot of people, I know personally one of my friends dealt with the same thing, and I know her mental health, journey with a worksheet started the same as you as well as suicide. And I know
Mhm.
personally suicide has impacted me personally, like I know has affected a lot of people as well. But like how did you kind of deal with that at times? I know with dealing with that,
Yeah.
like it's very hard. Like I personally at that time I had no idea how to deal with it.
Yeah, well, that's the thing too in that. So in that you have time and you're dealing with all these range of emotions and constant batter of daily life still and stuff like that. So
Mhm.
it's challenging sometimes to reach out for that support or even for other stuff and that. So me, like I know I was relying a lot on friends and family during that time and still do for stuff like that too sometimes. Like we all go through up and downs and things like that. So it's really good to have that support network and ensure that you're constantly reaching out to that support network and people that you trust to discuss some issues that you may be feeling or your mood in general, really. So
Mhm.
they were a big part in supporting me at that time.
Like I know for me, like I know I also relied and still rely on my family and friends for when I'm dealing with mental health. Like honestly what kept me going at that time is my family and friends. Like I know without family, friend support, I'm like, I'll probably be getting much worse with my mental health if it wasn't for my family. You know what I mean?
Mhm.
But
Yeah, they're a big part in really maintaining that positive mental health, at least for me personally, still now, right now, making sure that I continue to have those connections with friends and close friends and too, but also with family, like going out and doing stuff or being active and doing some of the other stuff I'm doing too out in the community, whether it be some of this mental health work I'm doing or other stuff as well.
And like with volunteering, doing stuff for mental health, in your community, like it's such a big factor, and also like helping others that are doing the same thing, but also using your personal experiences, whether that may be suicide,
Hmm.
depression, anxiety, whatever that may be. It's really kind of important to kind of bring your experiences personally to other people and to really kind of bring that journey to other people and to because there's so many ways that you can advocate for mental health. You know what I mean? There's not
Yeah.
just one
Yeah.
specific thing. And with all that, like I know with mental health and advocating for it, it can help so many people when talking about it and advocating for it in your
Hmm.
community.
Yeah, and you kind of touched upon it right there a lot too, and it's that sharing that personal experience and sharing your own story with other people to kind of not only show them like, hey, yeah, like you're not alone in this and everything. Like there's millions of people that are affected by poor mental health every year, and everyone is affected by mental health in their daily lives, regardless as to whether you have a diagnosed mental health disorder or not.
Mm,
But it's really that sharing story and personal experience that I really try to tap into. And I 2 3 years ago now, I actually shared a story with Unsinkable and Unsinkable Youth, which is another organization I kind of do some work with. In that they're a great organization that people are able to go share their own journey, their own story with, and everything like that. Not just about mental health and that, but in general, in that to really connect people together to bring that human back and everything like that.
And that is the most important thing because I know like with connecting people that are suffering with the same thing, it honestly makes people so much happy to know that they're not alone
Hmm.
in their journeys. I know personally when I talk to people about their mental health journeys, it makes me feel so happy to know that I'm not the
Yeah.
only one. It makes you like, okay, like should I at least talk about it more often? Because I know a lot of people are scared and nervous to talk about their mental health journey because they feel like they're going to get judged or they feel like people will see them differently. But you know, like it's not a bad thing to talk about it. You know,
Yeah.
of course, there's gonna be some of those people out there to judge you. Like, of course, that's part of
Yeah.
like a part of life.
It's it's
But
tackling that stigma though too, and that with especially with sharing your own story and stuff like that. So really working to break down that stigma and finding out ways to have those conversations in a constructive way that really destigmatize not only mental health and that, but like specific things as well that you may
mhm.
be talking about within that mental health group.
Yeah, you're exactly right. And I know you're from Canada, Ontario, and of course, we're living in Pennsylvania in the United States. Mental health is always different in different countries with different
Hmm.
people. But I was curious, like once I saw you're from Canada, I'm like, I have to ask this question, but what is mental health like in Canada?
Yeah, so fairly similar. Um, factors that influence mental health and stuff like that, they're going to be and are very generically the same in that you still have your um, multiple stuff, thousands of things that influence a person's mental health and that up here, especially when it comes to like your relationship with family and communities and your own state of being and stuff like that. But some of the policy stuff is different though for sure.
Yeah, like I know with a lot of mental health things in different countries, maybe like Canada or England or whatever. Like I know with a lot of mental health things I know is very similar to a lot of people, but the policies of every country is different. Because of course it's run by different
Hmm.
people, you know, democracy, that sort of thing. But like, how have you advocated for and created policies in Canada? Because of course, Canada, United States, of course, or North America, technically, but of course they have different type of policies, which is I mean, I don't know every single policy. Don't
Yeah.
like I don't know anything. I'm not a pro, but what are kind of some of the policies you create?
Yeah, so a lot of my, and I think kind of ties back into what I kind of said at the start too in that. So a lot of this advocacy work that I'm doing is was really started and branched off due to that personal experience and everything. So a lot of what I'm advocating for mental health wise and suicide prevention wise and that both federally and provincially here in Canada. So federally Canada, provincially, which would be state level, like this equivalent down there in Ontario. Um, is for better mental health policies and that with a few different target areas, but I'll touch upon a few of them here with you right now. And that one of the policy focusing areas that I do is education and knowledge. So I like to tell people that it's amazing to have all these resources that are there, but if people don't really know that they're there or how to access them, they're kind of useless.
Yeah.
Um, Bringing it back to my own experience too, in that all these great resources were out there in my city and that for me to access and that, but I didn't know that they were there at all. So they weren't really being beneficial towards suicide prevention, but also in bettering my own state of mental health at the time. Now I kind of know that there I've gone out, I've done my research in that, and that's really where that advocacy part comes in for that education and knowledge piece and that I do, and working to develop advocating for policies for better knowledge and like public expansion of these resources and that, but also just talking to people about them.
Hmm.
Let people know that these resources are here, these resources are there, and that. The National 988, which is a new number, both in the US and in Canada, actually, too, that we up here recently implemented just in November of last year. So I kind of helped to advocate a little bit for that from a youth perspective and stuff. But it's resources like this that are out there now that weren't out there before that are continuing to save lives or were out there before that were just made easier now.
Like that's very interesting. I never knew there was a new 988 number. I have to look
Yeah.
at and get for more information on that after this interview. But I love that you brought up the policies and people not fighting it because I know not a lot of people can access to those policies or even find
Hmm.
people that are advocating for it. Because of course, like you said, if people don't see those policies or see you doing different things for mental health, then it's of course very pointless. So like if people are not going to see it, then what's the point of creating a bill or a policy and advocating for it? With what's the point of it?
Hmm.
But of course, we're advocating for mental health. Like there's so many things you can use as a policy, whether it's like the suicide hotline, talking to your local senators or whatever. Like there's so many things you can do, but of course, creating maybe an initiative or something to bring attention to mental health in your community is very important.
Yeah, and it kind of, so I know like if I can touch upon this too a little bit right now with you, because it just kind of ties into a little bit more of that policy aspect in that. So every year, the last 2 years now, I've been compiling all these meetings and conversations I've been having with people out in the community, people my own age, older than me, all these other organizations and stuff that I've been meeting with to discuss these mental health issues and that. And I've been releasing these calls of action and that, meeting with members of parliament, which would be like your state or your federal representatives and that, but meeting with these members of parliament, members of provincial parliament, and MLAs and that, and advocating for these policies. So in December of last year, I released my calls of action for 2024 and that, and in there, there's calls to the federal government, but then also where I'm located in Ontario to the provincial government to really work to not only better the education and knowledge part, but also the access to resources and that, the streamlining of those resources and other things as well.
Ooh, that's really awesome. I have to look
Yeah,
up, like, well, check it out once it's up, like once I wrap this up. Because that seems right up my
yeah.
alley that I think a lot of people would enjoy as well. And like I know like with creating that, like how long did it kind of take you to create all of that for 2024?
Yeah, so I tend to have an interesting work stream in that too with everything. So I'm always advocating for stuff, always doing stuff if something comes up and there's a policy change or something like that. I'm always meeting with people and discussing mental health and
Hmm.
how can we better it for other people and that, especially after my own personal experiences with it and seeing how lacking these resources really can be at times in that.
Hmm.
But things like the calls of action, I really use that as a framework for the year ahead. So I know like this year's 2024 calls of action and that for mental health and well-being, there's 4 federal calls in it and 6 provincial calls in it. And I'm really using that as the framework for goals that I'm looking to see from these governments right now and other organizations and groups in that. So working those throughout the year, meeting with MPs, MPPs, senators a little bit, different committees, different organizations, people, everyone and anyone that really can contribute to this, which is everyone, to be quite frank, in that we all have mental health, we all have well-being in that. So there is something that every single person can do uh, to really work to better it, but also to improve it for themselves.
Yeah, you're right. Because of course, like you said, like of course everyone deals with mental health in different ways. Of course, like every
Yeah.
person's journey is different, but some might be similar. Like personally, like of course every mental health journey is something, it's very hard. And sometimes people do lack the resources in
Hmm.
where they live, or they can't find anything on social media, or they just don't feel supported. And there's so many things you can do that can help so many people that don't feel supported in their mental health journey. Because of course, uh,
Hmm.
there's thousands of people around the world, not just in North America, maybe in Europe or Australia or one of those outside countries in North America that are dealing with mental health but are struggling to figure out, okay, what are some hotlines? Of course, to talk to people like it's you have to be strong enough to be able to find that support, whether it's hotlines, advocating, or whatever it is. It really can take the lack of resources to find help.
Yeah, and it's really it's a lot of, and it can be exactly too. It can be that a lot of work, like you just kind of mentioned in that too, to really work out and find these resources, especially if you're in a mental health crisis and that. So like I know like the 988 number, the suicide and suicide prevention and mental health line, and that was just launched up here in November, and in the U.S. last year, as well. It's a simple, easy to remember three-digit number, just like 911, that people are able to dial and access, and it will automatically connect to you with a mental health crisis worker when you really need it. It's a lot easier than trying to remember a 12 or 10 digit number in your
Hmm.
head, or having to go and Google it and copy and paste it over, or write it down and type it in and everything. So
Hmm.
it made that service a lot easier for people to access. Um, and not so, I don't know how it is in the US. Maybe a little bit more towards like the Midwest and that, where it's a little more rural in that. But up here in Canada, a lot of our population is around in Ontario and Quebec, and really in that GTA to Windsor to Montreal corridor and that. So we
Hmm.
have all this land with people still living there and that, but the resources for healthcare really in general are lacking for those communities and that. So how can we better support people that are living in rural and northern communities and marginalized communities and other stuff like that?
Ooh, that's interesting. And I'm like,
Yeah.
I know with Canada, like it's very much different from how the policies like we talked about earlier is very much different. But with the suicide hotline, I'm very like glad to have a free digit number because it's like 911. But I'm
Hmm.
like I'm the type of person that does remember a lot of numbers. So I'm like, I
Yeah.
think it's like a
Yeah.
3 digit, something like 988. That's like easiest number they can ever think of.
Yeah, exactly. And that was the main purpose of it. So I'm happy to um see that it's having it being remembered by people.
Right. And so like of course you've been doing your mental health advocacy for a while and like how do you kind of tend to grow your advocacy every month or every day?
Yeah, so I tend to share a lot of personal experiences, really what it comes down. Pardon me, but personal experience is really what it comes down to in that. So how can I take what I've really lived through in that, and what I've seen, and a little bit of conversations of other people in that, and really use that to benefit other people in that? How can I make other people feel like seen and heard and stuff like that, while also using it to advocate for better resources and community supports and things like that. So that's where a lot of that building comes on. Really sharing those stories and experiences with other people, and spreading the positivity around, and letting people know that they're not alone in their struggles, or with a suicide attempt, or feeling down in general, really too, because it doesn't have to be that extreme all the time too. You can just feel
Mhm.
down one day and a little bit better the next.
Yeah, and with my mental health journey, I know with a lot of people like advocating for as much as possible is important thing to really post on social media.
Hmm.
And because I know a lot of people, everyone, mostly everyone has social media, so it's very easy to connect with a lot of people for Instagram, TikTok, Facebook, or whatever other social media is out there. There's tons. But
Yeah.
of course, with my friend, she has an encouragement card program, which is amazing that helps benefit people in mental health in different facilities in Florida. And I'm like, that is genius. Like, of course, having a encouragement card program for people who are struggling and to, make people's days by advocating, sending kind messages, and posting about your journey is a big part in everyone's lives that are dealing with mental health, whether it's a post or talking about it. It can be something very small, but it could be something very big in other people's lives.
Hmm. Yeah, exactly. And all that comes down to that like community sharing and storytelling in that. So I know like earlier on I mentioned Unsinkable Youth. They were a great organization that I wrote an article and a personal experience story for back in 2021. Really taking time to reflect upon my own suicide attempt, which would have been in 2019, but also working to reflect and see how far we've come in that, and the progress that you're able to make when you really work on your own mental health and well-being, and how much more you can do, really.
Mm-hmm, right? Because like of
Yeah.
course, like there's so many resources you can do, but I know with everyone, not everyone can do everything in terms of advocacy, even though for some people, like if you might see other people doing everything and there's so many things you can do that you're like, okay, yeah, I see this list. I might as well do everything. Like might as well to get more people advocating, but it's like, of course you're doing so much. It's like you might as well not overdo yourself to burn yourself out to do as
Yeah.
much as you really plan on doing. Is that okay? So when you burn yourself out, that's going to even damage your mental health more from personal experience.
Well, exactly. And especially when it comes to stuff like mental health and well-being, that like everyone's able to do something that whether it be working on like their own mental health and well-being or volunteering for an organization or community association or something like that. But every single person is affected by mental health, has mental health and well-being in that. So it's what can you do to improve it and make it better in that, whether it be in that singular moment or into the future.
Yes, there's so many ways. But it's like there's still tons of time to advocate. You don't have to do it right now. But
Yeah,
I
yeah,
know
yeah.
with a lot of people, like you might as well do it as like as soon as possible. You can advocate whenever. You can do there's a one-time thing. It's not forever.
Hmm.
Like you could do it forever if you wanted. I'm no judge, but it's like of course, but there's some tons of advocates out there, and there's so many, honestly, so many ways you could get involved as an advocate or as an activist, whatever you want to define it. And I want to ask you before we head off, you are the founder of Youth Mental Health March Canada. Like, what is Youth Mental Health March Canada?
Yeah, so this was an organization that I started back in 2020.
Mm.
So a few 4 years ago now. I almost said 3 years. I forgot the year change there. But yes, this is an organization that I started back in 2020, and that after again personal experiences and stuff like that. And the main goal of it is really facilitating those conversations around mental health, personal experiences, but also the policy aspect of it and that. So every year in May, we hold a mental health event and that really facilitating discussions around lived experiences and personal experiences and that. But then the second half of that is like a policy focused area on it. So there's a lot of events where you have um, some people come in, share a lived experience in that, and just have that first piece of the event where you have that conversation around mental health and well-being in that. But it's taking that and saying, okay, this is kind of what's happening. This is what people are feeling. How can we kind of work that into bettering everyone else's lives and that including the people themselves in that. So that's what that second half of the organization is that we really do through that event. Asking our elected officials, asking provincial leaders in that, what are you doing to better mental health in that? This is kind of what's happening in that. This is what we want to see. And almost like a policy forum in that, a Q&A type style second half.
That's really awesome. Like I had to look into the event in May. You said, right? It's in May.
Yeah.
I have to look into that. That seems something right up my alley. But where can people find more information about it?
Yeah, so you can visit ymhmcanada.ca. We haven't posted anything for this year's event yet because we're still doing some planning work behind the scenes and that before we put anything out. So stuff might be a little bit outdated. But yeah, ymhmcanada.ca, and there's some more information on there about the event.
Perfect. Make sure that everyone go check the website out and events. I'm sure it's gonna be such a fun time, and I have to see if I can make it because that seems something that is so fun that really seems right
Yeah,
up my alley. And I really appreciate you, Joshua, for joining us today about your journey. Of course, with mental health, it's such an important topic to talk about. I know whoever's listening, whoever's dealing with mental health, like you're seriously not alone. And there's so many people are dealing with the exact same thing as you. So don't be afraid to ask for help. And thank you, Joshua, for everything you're doing in your advocacy. It's making a difference. And I really appreciate all the work you're doing.
yeah. Thank you so much.
Of course, enjoy the rest of your day.
You too.